Mark students. So last class we have discussed regarding the breast problems, that is gynecomastia, isn't it? So breast abscess, breast mastitis. So like that we have seen the small conditions related to your breast. Today we will see breast diseases, mostly which are tumors and the malignant. Okay. So already I told you that cancer is in the form of two types. It is benign and the malignant. Benign in the sense it is non-cancerous, which can be removable through surgery and it can be curable. But malignancy, it can be removed by surgery, but it is very difficult to survive. Okay, very difficult to overcome it. It is a very serious problem. Okay, so today before starting the cancer and tumors in the breast, we will see the once again we'll see the anatomy. If you see this anatomy, first if you see they have given the clavicle bone. See why they have given that ribs and everything ante, if it is a cancer, okay, it can able to transfer to other parts. I told you, no, cancer as having the quality that it can transfer to other parts of the body. So see nearby parts. What is nearby parts of the breast? The cancer can go. So that's why they have given the nearby parts also. They have given the clavicle. It is known as collarbone. So it is upper border. The borders they have given. Okay. So the upper border of the breast is ended with the clavicle bone. And if you see the thing sternum, it is cider portion of the breast. It is also known as breastbone. Okay, and next thing is areolar is a dark circle. You all know nipples. You know, see inside the breast. If you see the gross anatomy of inside the breast, if you see the first thing is ducts which carry milks, and these ducts contains lobules, mammary glands, and some fatty tissue is there. See lymph nodes. See these lymph nodes only will be like a channels. See lymph nodes are nothing but, if you, for example, if you take a house, okay, so for the house piping system, drainage system, if you see in between they will be having some openings. So if anything, if blockage is there, no, they will open that small drainage and they will look first, then they will go to the big drainage system of your hose, isn't it? So if you observe in your house, definitely we know that they have some openings, they have some channels in the drainage pipe which is going outside. Okay, outside కెళ్ళకన్నా ముందే మన ఇంట్లోనే they will have some connections అన్నమాట. So if you have any problem, you can open it and you can see it. So same like that, our lymph channel also, they have lymph nodes like a um, gate pass. Okay, they will go through that. If anything is there, they will struck there. So if any cancer cell is there, nicely wherever the nearby lymph nodes, they will struck there and they will grow there. That's why they have given the gross anatomy of the breast. And this is a complete side look of the anatomy of breast. If you see, there is a fat tissue, there is a chest muscle, and nerves are there, and mammary glands, how they looks like, areolar, nipple, fibrous tissues. So these all are the common. See blue color are the yellow color is the fatty tissue, and blue color are the ducts, and green color are the lymph nodes, and this pomegranate like structures are there, no, red color, that is known as mammary glands. So quadrants of the breast, this is the quadrants they have given. See, just keep in mind, not that much important. So this is the common conditions of the breast. Fibroadenoma, that means a fibrous layer of the breast will get the cancer. Lobular cancer, that means each lobule inside will get the cancer. Ductal cancer, the tube like structure is there, no, if that get cancer, it is known as ductal cancer. And Paget's disease, that is nipple cancer. And fat and connective tissue disorders. And next thing is phylloid tumors. So the connection between two mammary glands or two lobules is known as phylloids. So if that connection got the tumor, then it is known as phylloids tumor. So now we'll see the first thing is in this is fibroadenoma. So what is oma? I told you oma is a cancer. It is a smooth discrete breast lump consisting of fibrous and adenomous tissue. It is firm, mobile, and it appears to shift position, commonly referred to as breast mice. So why? Because it is smoothly discrete breast lump. See how it looks like inside the breast. Nice picture they have given for your better understanding. See how the lump looks like. It's a fibrous one. It is a tissue, nothing but overgrowth of the tissue. It is firm and mobile. It can move there, and it can shift position. So commonly it is known as breast mice. See, mice, no, they will change their living from one place to other frequently. So today they will live at one place, and 1 hour they will change their place. Same like that, this breast is also, this lump is also can shift from one place to other place. So that is known as breast mice. Fibroadenoma, the second most common solid tumor after the breast cancer. So after breast cancer, what is the other most dangerous or big problem to the breast is nothing but fibroadenoma, and the most common benign tumor in the women. So after cancer, what is the main big tumor, non-cancerous tumor ante? It is known as adenoma, fibrous adenoma in the women. So mainly it is a painless, firm, solitary, mobile, slowly growing breast mass. So already tumors are, we know that tumors are will grow slowly. Malignancy can grow very fast. It is the most common breast tumor in young women under 30 years of age, and growth may be accelerated during pregnancy. So this is very common under the age group of 30. That's why I told you, no, whenever you get teenage, so from there onwards you have to perform your breast self examination, so that you can detect like these tumors early, and you can go for the treatment very early stage. So it is usually detected within 2 or 3 centimeters in size. Fibroadenoma can cause drastic asymmetrical growth of the breast. When larger than 5 centimeters, they are classified as giant fibroadenoma. So when it is bigger one, then it is known as giant fibroadenoma, more than 5 centimeters. Mostly these are non-cancerous. They can remove easily. So if you see the types of, see how the breast look like somewhat. So that's why if you see the breast self examination on the in front of the mirror, you can nicely observe your one breast will be sizes increasing and one breast will be low in size, so that you can detect that something is wrong in your breast. So pericannular type more fibrous, intraclanular type it is less fibrous. So pericannular and outside the tissue they will be having a tumor. Intra means inside the tissue. If they have tumors, it is known as pericannular and intracannular. Giant fibrous, I told you no already, more than 5 centimeters is known as giant fiber. See how breast looks like. So that is the thing. So these are two types, intracannular and pericannular. Peri means outside only you can see. Intra means inside the duct you can see. And giant fibromas is an uncommon variant of, mostly these are only 4% of women will get. It is uncommon type characterized by rapid growth. Peak incidence occur in late adolescence. The size of the lesion is usually more than 5 centimeters, but it is encapsulated and benign. So they have capsule. So that's why they cannot go from outside. Okay, hard wall undanamata. So inside the tumor, it will not come out and go out. And benign, the underlying mass may cause a major distortion to the breast counter. So next thing is the typical presentation is in a woman of reproductive age with a mobile, what are clinical manifest, these are the types of and now we'll see the clinical features. So mostly what is thing under the typical presentation in a woman of reproductive age with a mobile palpable breast lump. So when you palpable, no, it is check, it can change position. One, when you are palpating one side, it will nicely you can observe that it has shifted to other place. So due to their hormonal sensitivity, the fibroadenoma commonly enlarges during the pregnancy and also involve it at the menopause. So I told you, no, it's a mostly commonly occurs at the age group of below 30. So sometimes it may comes again after the menopausal due to your hormonal imbalance. So hence they rarely present after the age of 40. So the lesions are well defined and well circumscribed clinically, and the overlying skin is normal. The lesions are not fixed to surrounding parenchyma and slip around under the palpating hand, and hence the colloquial term a breast mass. So I all told you that it can be movable easily because it doesn't have any connections to the one part to the other part. So it's just like a tumor which is having one big hard capsulated cell wall. So nicely it can, like a ball, it will be traveled from one place to other place. So this is a tumor they nicely has shown you. So mammography investigations, mostly if you see mammography there you can identify the aroma thing. Okay, so density, halo sign, macro calcification can be seen. A popcorn appearance will be seen. So an oval shape, then ultrasound you can take. See like how the all the tissues, and one thing they have black color, no, that is known as fibroids. And needle core biopsy, you can take a small tissues from the breast and you can take it for investigations. So fibroadenoma management, how you can do the management? A fibroadenoma doesn't require excision unless so associated with suspect cytopenia, because it's a very small one, no, you cannot go for the surgery. If unless it is a giant one, you can go for the surgery. And if needed, no, you can deal that lumpectomy, cryoablation, ultrasound guided percutaneous suctioning. These all can be done. These things. What is lumpectomy? Where the lump is there, where the hard tissue is there, where that tumor is there, you can identify it and you can remove it through the needle, through the small surgery. And what is cryoablation? Cryoablation is nothing but a small needle is placed in the tumor center under local anesthesia. So the tip of the cryo means ice amma. So whenever we put ice, no, more time ice kanka meeku pattukunte, your first sensation మీరు ice పట్టుకోండి, what will happen after some time, no, few minutes your hand will become numbness, white color numb అయిపోతుంది. If it is more a time, if you are putting ante, your cells and tissues will die there, okay, because of that coolness. So same like that here, it is extra cell, no, that's why more ice we will, that procedure will perform, more ice we will give, ice crystals they will send and they will kill the tissues under the ultrasound. So they can see, and through the one needle will be there, and that needle they have the camera and they can see the screen monitor, and then they will cryobe the tissue area. As shown in the 1 year follow-up, 50%, 92% will be through the cryo. So this is a main procedure that they can do for fibroadenomas. Lesions must be visible on ultrasound. The diagnosis must be histologically confirmed when to prefer surgery. The mass must be less than 3 centimeters. Then only we have to perform the cryoablation. So exclusion criteria includes histology of cytosarcoma, phylloids or any other malignancy, poor visualization of tumors or ultrasound, a core biopsy of fibroadenoma, that is non-concordant with the physical examination. So it is nothing but exclusion criteria means when we have to not perform the cryoablation. That means contraindications. The first thing is if there any other malignancy are there, you should not perform this. And second thing is if you doesn't palpate or doesn't see the tumor in the breast clearly when you perform the ultrasound or mammography, that time also you cannot perform this. And a core biopsy of fibroadenoma, that is non, so when you do the biopsy, if the reports are not well good or any undefined it came, then also you cannot done the cryoablation. Then what is percutaneous suctioning? It is ultrasound guided placement of a 10 gauge 80 ECP vacuum needle, and suction of tumor under local anesthesia should be there. And they have until big needle and big syringe will be there, and they will suck it out of the tumor tissues. This is about the fibroadenoma condition. Now we'll see what is fibrocystic breast. So fibrocystic breast, this is commonly called as fibroadenosis. It is a benign condition where small lumps are felt at the breast. I told when the tumor is filled with the fluid, then it is known as cystic. So that means a harmful, the fibers are not harmful. So, but it is uncomfortable for the woman. More than half of the women will develop the fibrous breast tissue, and some point in their lives many women will have by fibrocystic breast. That means fluid filled tumor in their breast. So already they have given fluid filled sacs, smaller sister harder to feel, but they may get bigger over time. So because already breast will have some lobules and very soft structure, and this cyst is also very soft because it contains fluid. So that's why we cannot recognize it in early stages. When it grows, no, that time you can assess it. See, like this cyst, fibrocystic, and is very commonly disease, a very benign one, and not harmful, dangerous. More than half of the women will develop fibrocystic disease, not fibroadenoma. So they can be further classified into fibrous and the cyst. So this fibrous is known as, it may be a scar tissue and rubbery, hard to touch. Cystic is a fluid filled and very soft to touch. Signs and symptoms, there may be breast swelling, thickening, lumps within one or more breast, and sizing will be different in the breast, and the lumps are also round and mobile but not as mobile compared to fibroadenoma. See, something they can move but not that much like a fibroadenoma. Generalized breast pain and tenderness, nipple discharge, which is usually brown in color or green in color. Itchiness, monthly increase in breast pain or lumpness from mid cycle to just before your period. So these can be the symptoms for fibrocystic breast. So pathophysiology, they have given the exact mechanism of the condition is not fully understand because there is no cause for any specific tumors or the cancers, and because of your hormonal levels only they have studied that usually because hormones will be suppressed during your menopause stage and after the your stoppage of menstrual cycle. So that after that there is no hormones, that's why most of the people will not get any breast cancer during their menopausal period. So only menstrual cycle only you will have more hormones and fluctuation of hormones will be seen. So that's why you can get the cancers and all fibrous or cystic disorders to your breast. So the hormones directly affect the breast tissue by causing cells to grow and multiply. Many other hormones such as TSH, insulin, growth hormone and growth factors. So these all are the hormones that are regulating in our body. They may have effect on your breast tissue, and such fluctuations eventually produce small cyst, multiple small cysts, and increasing level of breast pain commonly develop when woman hits her 30s. So adenosis involves abnormal count and density of labor units, while other lesion appears stem mainly from nothing but here they have given mostly this adenosis will be occurred to the lobules, not other than the tissues. Investigations, mammography can be same investigations will be written for all cancer related to breast. So mammography, ultrasound, CT scan, biopsy. Okay, MRI, CT scan or biopsy. So management includes, so most of the management with fibrocystic changes and no symptoms does not need treatment, but close follow up may be advised. So no, not because these are a small one, no, only observation should be there and no such treatment should perform. So if anything pus is there, you can aspirate through the needle, and over the counter pain relief should be given. And for severe symptoms, no, they have given some bromocriptine and OCP are prescribed, danazole. There are usually no side effects to this condition, mostly subsides after the menopause. A possible complications arise this is a cancerous tumors may more difficult through the fact that cancerous tumors are more difficult to detect in more women with fibrocystic changes. So if any fibrocystic changes are there, you can first it may convert the tumor, but if you think it is a fibrocystic change only, then the person will get future they will get the cancer and the problems. So this is about the fibrocystic breast. So we have seen what is fibroadenoma, and now we have seen fibrocystic breast, and third one we'll see the Acute mastitis. So what is acute mastitis? Itis means inflammation. So this thing next class I will tell Amma. Why? Because these two classes you go through that now, again you will get confusion. So mastitis one class will see, and breast cancer one class will see, and after mastectomy what is the nursing management for the patient after mastectomy, we'll see. The three conditions are there in this unit. So mostly the important question in this unit is menstrual cycle, menopause, and this one, breast cancer is a, and cancer signs and symptoms, and sometimes that what is the difference between benign cancer and a malignancy cancer. These are the important questions that you have to go through. So next class we'll see the mastitis and the breast cancer.